Hello, everyone, and welcome to today's webinar, From Foul to Fresh, Addressing Top Restroom Complaints and Health Risks. I'm Ann Cosgrove, the Editor-in-Chief of Facility Executive Magazine, and this webinar is presented by Aramax Professional. Before we get started, I would like to cover a few housekeeping items. First, please note the control panel that's on your screen. This is where you can submit questions in the question box in that panel. Please send your questions in at any time, and our speaker will address them after the presentation. Also, please note the orange arrow on the left side of your control panel. Clicking on that arrow will either expand or collapse the control panel. So please be sure that it is expanded so you can access the question box there. Now, if at any time you experience a technical difficulty, please send a message to us also in that question box, and we will address it right away directly with you. Now I'd like to introduce your speaker today, Jeff Dryfhout. Jeff is Global Director of Air Treatment at Aramax Professional, and over the past 20 years, he has served in various marketing and innovation leadership capacities in organizations such as Quaker Oats, ConAgra Foods, Sara Lee, and now Fellows. An MBA graduate of Pepperdine University, Jeff also serves as an adjunct professor at his alma mater, Trinity Christian College, and he serves on the school's Business Advisory Council. With that, I'll hand it over to Jeff. Welcome, Jeff.
Great, thank you much, Ann, and thank you everybody for joining me on today's webinar, where we're going to talk about fun things such as restroom complaints and just overall health risks. So really appreciate your time here. So with that, let's get going. So first of all, what I really wanted to kind of focus on today is going to be the role that air has, specifically within the environment of an organization, and then particularly within restrooms. And why is this important? Why should we even really care about this? Well, first and foremost, restroom air. Restrooms are constant sources of contamination. You know, it's the one place within a building where everybody goes throughout the day, be it a school, a facility, a hospital, whatever that may be. Employees or building occupants are going to be going to the restroom anywhere from 4 to 7 times throughout the day. So it plays a significant role in the lives, and also is a pretty huge influencer on the perception that one has of the organization. Clients, customers use these facilities, and what's interesting is that studies are shown about 2/3 of people believe that restrooms are a direct reflection of an organization. And this kind of makes sense, right? If we've ever been to a place where we go into a restroom and maybe it's just not that great. It could look clean, but maybe it has a smell or an odor, or you just don't feel that it's a very clean type of environment. That is indeed a reflection of the organization, and maybe even how they feel about their employees and the people that are in that building. The other thing about restrooms, especially in shared environments where there's lots of people, is those restrooms generally do not have seats, or they have seats. They don't have lids on their toilets. And that can have a really direct impact on cleanliness. And to that end, flushing toilets really equal dirty restrooms. What we see here is actually a computer model, and I'll spare you the motion and the details on here, but what this is actually a women's restroom with 6 toilet stalls, and this shows what's happened when you flush those toilets. So what happens is, because they don't have lids like a toilet that you have in your home, what is basically in the toilet does make its way kind of projected throughout in the air. And so what you see here is actually the plume of contaminant that takes place within the stall that makes its way up and over. And you know, unfortunately, this is something that you'd be breathing in. And so certainly we want to address it. That's why we're here today, to talk not only about restrooms, but talk about the role of air and the role that air has on your total environment. So with that, we really see air as the future of clean. Today, you are probably taking steps to create a clean environment today. We do things like cleaning our hands. We use hand sanitizer to protect ourselves from the transmission of germs. We teach our employees and our students the importance of cleaning their hands constantly throughout the day. In addition, the role of cleaning surfaces. This is surfaces such as desks, high touch points such as doorknobs, phones, things like that. Even our restrooms. Our restrooms are now being equipped more and more with touchless type of equipment, right? Touchless faucets, touchless toilets, touchless paper towel holders, things like that. So it's all in an effort not to transmit any germs. But really what we want to talk about today is the role that clean air has in keeping things clean, right? Whatever is on a surface or on a hand was at one point in the air. And unfortunately, it's just something that we as kind of leaders within the facilities don't really think about that much, but it has a pretty dramatic impact, and I'll walk you through what that is. So today, we really want to talk about why should I care about the air in its role within a facility and specifically within restrooms, what drives those air problems, and then give you some really practical ways of addressing what you can do about it. So these are the three things we want to cover. So with that, let's get into why should I care? Why should I care about the air? What I hear a lot is, Jeff, you know what, my air is fine. You know, I don't really smell anything. I don't have any bad odors. You know, so I feel like it's really okay. And I'll talk to you a little bit about why we need to go beyond just really the detectable things that we can sense. Because the things that actually make us sick are the things that are things that we can't really sense. But first of all, why should I care? The first big reason is indoor air quality is something that impacts everybody, right? If everybody that walks into your facility, into your school, into your office is taking in and consuming your indoor air that you're providing to them. It's also something that's very much involuntary, right? It is something that you are actively taking in and breathing, and so the quality of there, it's not like we have a choice to say, well, I don't want to breathe in this type of air. I want to make another choice. But it's something that is certainly there, and it impacts everybody, not only those that are in your facility, but your guests, your partners, and things like that. And just to bring that to bear a little bit more, as we think about our everyday lives and the daily consumption, and that we put so much effort and thought into the things that we put into our body. And take water, for example. We, on average, as Americans, take in about 2.5 cups a day of water. The type of water we bring in, where was bottled water 20 years ago? Where was filtered water? There have been advancements that have taken place to really remove the impurities of water, and now it's just become part of our everyday, if you will. In addition, our daily consumption of food, on average, we eat about 5 pounds of food a day. We put a tremendous amount of attention into the quality of the food, the types of food, how pure it is it processed, not processed, organic, natural, what the caloric intake is. So, and the reason why we put so much effort into the type of food and the type of water that we put into our bodies is because it has a direct correlation to our wellness and our health overall. And so we want to be conscious of that. But are we thinking about the air, right? The air is something that we consume as well. And I think you'll be surprised to see that we actually consume about 3,000 gallons of air a day on average. So we've got a heightened sensitivity and awareness to the type of water, to the type of food that we consume, and making sure that the bad stuff is out of it. But we may not be thinking that way specifically about the air. And that's why we need to care about it, is because it is something that is coming into our body and it's impacting our well-being. What's also interesting and why we need to care about the air is that indoor air is actually more polluted than the outdoor air. This is surprising to many. It's anywhere but from 2 to 5 times, and in some studies say even 10 times dirtier than the outdoor air. Outdoor air is what gets most of the press that's around outdoor air pollution and things of that nature. But indoor air is taking outdoor air, bringing it inside. But any time that you introduce people to an environment, they're contaminating the air, right? In addition to that, there's equipment, there are objects, materials that are inside of a building, such as copiers and carpeting and furniture and chemicals, cleaning chemicals, that continue to just contaminate the air inside, and because it's inside, all of that air really gets trapped and stays contaminated within there. The other issue is that we just spend a lot of our time indoors. On average, Americans spend about 90% of their time indoors, be it at work or at school or at home, and in much of that time, it's done within a shared space. And what we mean by that is being in an environment where there's other people. And as I've mentioned before, other people are what contaminating the environment, right? No fault of their own. It's just part of human existence, is that we are actually sharing our germs and other things like that. So indoor air is more polluted. We also want to care about the air because we do want to reduce those common complaints. And so as facility leaders, I'm sure you are affectionately known as the complaint department, right? And so the ability to reduce those amount of phone calls and emails complaining about air-related issues certainly is one of the reasons why we need to think about the air. We also need to think about the air in a clean bathroom, specifically because of the impact it has on productivity. We all as leaders are looking for ways to improve productivity. How can we get more out of our employees and our students? How can we have them achieve to higher levels? And one of the easiest things that we can do overall, and one of the most effective productivity measures, is quite frankly just keeping employees from getting sick in the first place, right? Showing up, being present. Because when we're absent, that's when productivity takes a nosedive. And so the role of the air, and I'll talk to you a little bit later in the presentation about how it does that. So reducing absenteeism, we know that the cost of just one employee's sick day can get into the thousands of dollars from lost productivity, lost quality, things of that nature. And we know that improving indoor air quality can reduce absenteeism specifically caused by issues related to allergies, asthma, flu virus, cold virus. These are all respiratory viruses, which means these are viruses that you're inhaling. You're breathing these in, and it's making its way past your body and making you sick. So, finishing the thought around productivity, as we all know, our biggest investment and also expense within any organization is the people, right? Employees represent about 90% on average of an organizational's costs, right? Salaries, medical, benefits, things of that nature. So indoor air quality is kind of a secret little tool here, because unlike many productivity measures that require employees to actively adopt and actively do something to change their behavior, all one has to do is breathe with clean indoor air, right? And so I'll talk to you a little bit more about how to really get into what I like to call passive productivity, right? It's productivity improvements without anyone having to change any of their behavior. So we also know that improving productivity has a positive impact on the dollars that employees can produce every year. So thinking about the positive productivity that can happen here, multiply that times the number of employees or the number of students or number of people within an organization, it can be very sizable for that 90% of investment. Here's the other thing. As I mentioned before, we as people just, unfortunately like to share. We like to share our germs, and everybody gets sick. And despite our best efforts, there are still 1 billion colds that happen, 60 million cases of the flu that happen every year here in the U.S. And we've done a lot, really, to protect ourselves, right? I mean, over the last 10 to 15 to 20 years, we know more about, and we take more action in preventing ourselves from getting sick than we ever have. But what's interesting, specifically about that, is that people are actually most infectious before the symptoms even show up, right? And so what happens is, if you come in to work, you may not even feel sick yet, but you are the most infectious. And so what's happening is the indoor air is at risk before someone even takes a sick day, right? There was a study done by Staples, the office superstore, that they submitted not too long ago, which talked about 60% of workers knowingly go into the office when they're sick. I'm guilty of this as well. The reasons behind that, are many. But many times what we're hearing is, I don't know that anyone, I've got to do my job, right? I don't know that someone else can do my job, or no one else is available to do my job. Or maybe it's even a bit of a badge of honor, right? I'm going to still kind of, drive through it. I'm going to get through this sickness and overcome and still go to work anyways. Well, what's happening there is actually having a significant negative effect on everyone else within the workplace. And so when they say, if you're feeling sick, stay home, please do. There are some studies saying that when you come into an office sick, there's the likelihood that you're going to infect 15% of the people that you actually come in contact with. So that's pretty significant. So what do? Well, we get ourselves a flu shot, right? Well, last year the flu shot was only 19% effective. So for those of us that decided, and including myself, decided to get a flu shot, 8 out of 10 of us, it didn't even matter because the flu virus actually mutated. And we know that the flu shot is actually a guess anyways. I don't know if you guys have seen the recent news as well, but actually the nasal spray with the influenza virus, they've actually stopped using that now this year based on the recommendation because of its very poor lack of effectiveness. So here's the deal. Flu cases, given all we know about washing our hands, right? Coughing into your shoulder, getting the flu shot. Flu cases have not improved. The 2015 data that I have says the same. This is the annual percentage of people visiting a doctor's office for influenza-like illnesses. It hasn't improved, and in some cases it actually looks to be trending the other way, and this comes from the Centers for Disease Control. They actually have a whole group that measures this. So why is that? How is that even possible? We know more now than we ever have around that. Why we also need to care about the air is the fact that a lot of people have allergies. 1 in 5 people suffer from some sort of allergy, so 20% of those of you on the phone right now, you can raise your hand, suffer from some sort of allergies, be it a seasonal allergy, an allergic reaction to dust, animals, things like that. And for those of you who have allergies, it stinks. It's terrible when you're having allergies. Your scratchy eyes, you're sneezing, coughing. It's something that obviously impacts your health and well-being and your productivity. For those of us that have children or are involved with schools or kids, the number of kids that have been diagnosed with asthma is skyrocketing. The National Institute of Health is showing that those that are under 5, there's a 160% increase in the amount of kids that are being diagnosed with asthma. And why that's important to us is the fact that the quality of the air has a direct impact on those that have asthma, right? So what you want to avoid if you have asthma is any asthma trigger, right? So something that you inhale in could actually impact and trigger an asthma attack for those of you that have that chronic condition. So absenteeism from asthma and allergies is pretty significant. Millions and millions of days, school absences, lost work days take place because of airborne related issues. Okay? Excuse me. Something that you guys also may have heard about as well is something called sick building syndrome. IFMA, the International Facility Management Association, had this on the cover of their magazine earlier this year, talking about how the EPA has indicated that this is a significant issue. And what this is basically by spending time in a building, you're not feeling good. The building is causing you to be sick with a headache, to stinging eyes, or whatever that may be. And you might think, oh, that makes sense for older buildings. But actually 1 in 4 newer renovated indoor buildings may actually be classified as sick as well. Some of the newer buildings are being built so energy efficient that the air is remaining inside that building longer and being recirculated, causing problems. On the other side, there's a positive side here of saying, hey, you know what? Air can be a plus. This is something that you can actually improve your institute's perception. So we all know that clean and healthy facilities make a great impression. So what is the role that we can use of cleaning the air proactively, right? The same way where now we have filtered water, right? That's a positive element that we've got out there. Okay, so not to scare you too much there, but that's why we need to think about the air, right? That's why we're on this call. So what drives poor indoor air quality, both in restrooms and then even outside of restrooms? Well, as I mentioned before, the item that usually gets most of the press is air pollution. And what you see here is actually a shot from NASA, NASA satellite imaging, basically showing the dirtiness of the outdoor air, basically the density of the air with PM 2.5 across the U.S. And as you can see here, color coding: blue is good, red is bad. What you can see here is around urban environments, around industrial, you see a tremendous amount of airborne particulate that's happening. You even see the role that the topography of the place might have, such as the valley in California, and you see how all of that air can be kind of collected and contaminated in that area. So with that being said, be thankful you don't live in some other areas, and if you do live in northern China, you know exactly what we're talking about, right? In China, in northern China, you can see that deep, deep dark red, which is 8 to 10 times more polluted than the World Health Organization deems as acceptable. And that's due to significant amount of manufacturing that is related to coal. Same thing happening in northern India, where there's tremendous amount of issues. And then northern Africa, where you see a lot of that is environmental, with windblown contaminant that then gets inhaled and taken in. So this is pretty significant. 80% of the world's population actually lives in a place where there's a high degree of air pollution. So I spoke to allergens before, right? About 20% of people having allergens. And what drives the issues around it? It's a year-round concern because certainly in the spring, summer, fall, and winter, there are things related to pollen and blooming of flora outside that is causing issues. But allergens can also happen year-round, such as indoor mold, dust mites, pet dander, and other things that I won't mention. But anyways, those are things that are causing your people and your building occupants some discomfort and impacting their well-being. So being able to clean the air and rid them of these issues is absolutely key. To that end, I'm sure we've all seen the dynamic when those on a sunny day, those sun rays come through the window, and what do they show? They show those floaty things happening in the air, right? You can see dust, and what that is dust and hair and probably even skin flakes and things like that that are there. And what's happening is you're breathing that in. And the Asthma and Allergy Foundation of America says you may not be allergic to, ragweed or a dog, but a lot of people are allergic to dust. And so that's a significant issue. On bathrooms, this is an area that's probably one of the biggest complaints that people with restrooms have is odor, right? Kind of natural. It's a constant area of contamination. What do we do? What are some of the solutions that we have? Well, generally, what happens is we mask the odor, right? We make it smell like vanilla or, some other strawberry scent, on top of that. What's happening when we do that? When you put those spritzers, in a bathroom, or you've got a candle or something like that? Well, you're only masking the odor, right? You're not actually removing it. You're adding artificial contaminants into the air, which is really the opposite of purifying, right, and making things to their natural state. So it's kind of the analogy of adding some more chemicals to water to get rid of the impurities or to mask the fact that there were, other things in the water. We don't want that. We want to get rid of the issue that is causing the air and capture that. One of the things, so that's a detectable issue, right, the air. The one thing I mentioned earlier is the fact that the non-detectable is what is really impacting us. And so to the extent you might say, I don't have an air issue because my air doesn't smell. Well, that's great. But how you doing with, virus levels, germs that are in the air? And there's no way to detect that with the human eye or the human senses. The Centers for Disease Control states that the air is actually more likely to transmit the flu than surfaces. Now, this really goes against a lot of the behavior that we take, right? So what have we really been taught? We've been taught to sanitize your hands. We've been taught to wash your hands and clean your surfaces. And that all makes sense, and we need to continue to absolutely do that. But the reason why the flu, as I showed in that chart below, really isn't declining is the fact that we're getting the flu because we're breathing it in. So we can wash surfaces all we want, but if we're contracting the flu virus by someone talking and that going in there and breathing it in, it's really not going to impact and make us any better, is it? We need to continue to wash our hands and wash surfaces because think about it, whatever's in the air does make its way down. And to that extent, this is how viruses are spread, right? So as I talk, as I sing, as I cough and do whatever, stuff comes out of my mouth. Some you can see, some you can't. The large and smaller droplets that are infectious do land on surfaces, and they do land on hands. So we do need to keep doing those things from a hygiene standpoint. But we haven't completed the clean cycle there, right? Because what's happened is that there's small infectious droplets, nuclei. They're so small that they can stay suspended in the air, and what happens is we breathe those in. This is proven out in many studies, and one recently from MIT found that droplets just from a single sneeze can contaminate an entire room and stay in the air for extended period of time. There's studies that show that the flu virus can actually stay in the air for 6 hours at a time. To that end, many people ask me, well, why is it that we always get sick in the winter, right? And a lot of the hypothesis behind that is, well, we're indoors more. Well, as I stated before, year-round we're spending 90% of our time indoors. What's happening in the winter generally is that your indoor air becomes drier. And so that airborne, that influenza virus can actually stay suspended longer in the air, increasing the probability that you're going to be inhaling that, right? So that's why we really need to think about cleaning the air to protect our employees and our students from getting sick. What are the other things that contaminate the air in our restrooms? Some of the cleaning chemicals, right? As we clean restrooms, as we clean kitchens and areas, many of them have VOCs in it. And what VOC is basically a carbon compound that gets evaporated into the air from an object. All of the items that you see here are kind of the leading problem children of VOCs, from office printers and fax machines emitting VOCs to older carpeting and linoleum, fiberglass. And as I mentioned before, even in our best efforts of cleaning chemicals may have VOCs. And the problem with VOCs is they're not only in a lot of different things, but they can also trigger problems with headache, asthma, and allergy. So if you have people within your organization that are complaining about having headaches and things like that, you can't really figure it out. What is it? It may be a VOC. It may be something that is in that air that needs to be cleaned out and removed. So with all that being said, why we need to be thinking about the air, what are some of those drivers, what can we actually do about it, right? Well, there's good news. The first and foremost is identifying sources, right? Where is it coming from? And as we talk about restrooms, that is a huge source. But I think overall, identifying the sources is key. And by the way, hint, hint, it's your building occupant. It's the people that come in. They're the ones that are carrying germs. They're the ones that are carrying flu. They're the ones that are going to go into a restroom and contaminate it, if you will. So that's just one of the things, is that that's okay. We want to be able to just identify where the people are gathering and being able to clean that. The other side of it is avoid using building or materials that are contaminating the air quality. And we talked earlier about things like VOCs and things of that nature. So what we also hear a lot is what we can do about it is really go beyond HVAC, go beyond heating, venting, and air conditioning. And the reason why I say that is I hear so many people saying, well, I'm fine, my organization's fine, we have an HVAC system, right? Well, every building has an HVAC system, by the way, but an HVAC system is really designed to do what? It's designed for temperature control. It's designed to make things warmer, or it's designed to make things cooler. And it's also meant to really move air around, right? It's not really designed to clean the air, right? All of that bathroom analogy that I showed you with the red plumes was actually done with the HVAC system working. All of the measurements that we do within buildings show that HVAC systems don't really clean the air, because what they're doing is actually spreading it around. ASHRAE, which is the leading organization for building guidelines, has actually put out a whole full white paper that indicated that the HVAC systems are actually big proponents of spreading airborne germs and viruses. They don't create them, but what they do is, as I sneeze in one room or as I talk in one room, it's going to take that air, suck that up, and move it from one room to another room. And unfortunately, my next door neighbor now may be getting that by breathing in my germs. So that's really the issue. It's really the analogy of, if I'm sweeping dirt up, if I sweep it from one room to another, have I really made things cleaner? No. In the effort, you've just moved where the problem is, and that's what HVAC is really is doing. So what we're saying is we need to incorporate this idea of cleaning. So just like you do with water, with cleaning your water and having filtered water, we really need to have filtered air, right? Because air purification, what that does is it removes and captures rather than redistributes the vast majority of airborne pollutants, right? So it's going to capture the flu virus. It's going to capture the dirt, the dust that's in the air. It's going to capture the allergy and allergen. It's going to capture the odor, and want to be able to move that into something, capture and clean it, and then release the purified air. Okay, that's what's going to really solve us here. At Aeromax, we do have a line of products here, a commercial line that has that are designed for shared spaces. It's designed for spaces where there's a lot of people. We've got for all different sizes, anywhere up to 300 square feet, up to 1,400 square feet. And these are designed to exchange the air and clean the air up to 5 times an hour. So that's constant cleaning, right? And as we talk about all those contaminants that can impact a room, how does filtering and how does air purification work? Well, it's a multi-layer system where the first layer there, that number 1 shows, there's a pre-filter. So for all that stuff you're seeing, through the sunbeams, right? All that dust and hair and skin, that's that first pre-filter. What about the odors and VOCs that I'm going to get from bathrooms, that I'm going to get from kitchens. Well, that's where the carbon filtration comes in, where those odors, that air is sucked in, and then as it passes through the carbon filtration, it's going to be absorbed. True HEPA filtration. This is that HEPA filter. That's a hospital-grade filter. That's going to capture the germs and the viruses all the way down, 99.97% of any of those really small viruses and germs. And then lastly, there's also ionization for an extra level of protection and effectiveness of being able to capture the particles. And what that does is it sends out a positive and a negative charge, and it attracts those particles, those smaller particles, so they're easier to capture. So let's go back to our lovely bathroom where we've got, without filtration. What happens when those 6 toilets within that women's restroom is being flushed, right? Well, what happens is when you add Aeromax in there, or you add filtration in it, as you can see, that box right over those stalls is representative of Aeromax, and what's happening is it's capturing immediately all of that contaminant that might come out of that toilet. And what it's doing also then is it's introducing cleaner and more purified air rapidly. And so it's a significant effort in being able to clean a restroom because it's capturing all the dirt, germs, odors, viruses, stuff that, unfortunately, once in a toilet could come out. And so we say clean where it's needed the most. And one of the, given the traffic that happens within a restroom and 100% of employees using the restroom 4 to 7 times a day, that's a huge place where you'd want to clean the air right away. To that end, another way to make the invisible visible, right? How do you know if your air is clean? Indeed. We've got something actually called a particle counter that measures the amount of particles in the air down to that virus level. So this is actually a measurement of a fitness center that's in a hotel. A hotel actually approached us about that, and they wanted to make sure that their guests were, as they're working out, they wanted to make sure they were breathing in clean air. And so what you see here is that this is taking a reading every 30 seconds, and that you're breathing in 25,000 particles. Some of that might be a problem for you. Some of it might be okay, but it's a dirty level, right? And so what happens after you introduce Aeromax is that there's a 70% reduction in the airborne particles. And what's great about Aeromax is there's technology in it where it constantly cleans. It's got sensor technology that knows when it needs to detect the air in the building occupancy or the room occupancy to increase and decrease. But overall, the ability to reduce the 70% less flu, 70% less allergens, 70% less dust that is in the air, that's significant. So that's decreasing 70% improvement in your reduction of someone in that room getting sick. Okay? So really what we say is, what can I do about it, is think about your organization. Where are people the most, right? We already talked about restrooms, but some of the other areas, if you're in a school, right, that may be a great place. In the classrooms, especially the younger kids, right, those that aren't maybe thinking about their hygiene as much. Locker rooms, people were gathering, where there might be mold forming. Conference rooms, people that are using conference rooms throughout the day and sitting in a very close proximity environment. Lobbies, cafeterias, break rooms, places where people stay very closely. So that's where we would really highlight where you might need it the most. So that being said, as we think about restrooms and increasing the wellness of your building occupants, what can clean air do? One, it can improve your productivity, right? Good stuff going into your body like clean water, clean food, clean air is going to improve your overall health, wellness, attitude, well-being, and what it's going to do is also reduce your absenteeism. What I mean by that is if we can reduce the amount of influenza virus, the amount of allergies, the amount of rhinovirus that's in the air that you might be breathing in by 70%, that's going to have a direct impact of how many people are getting sick, right? This also elevates your clean perception. Where you've included air purification and where we've seen it ourselves, employees see that, right? And that's a big positive thumbs up that they give to the organization, because you've taken that extra step to clean the air, to protect those employees. Reducing common complaints, and the detectable complaints such as odors is a big one. And then lastly, it just creates an overall positive, health-focused environment. So, with that being said, certainly want to thank you for the time, guys. I thank you, and I would want to challenge you guys to think about the air as part of your cleaning efforts. So as you clean hands, as you clean surface, certainly look at cleaning air. as part of your overall cleaning regimen, I think you'll be happy that you did. For more information, certainly go to airmaxpro.com. If your organization is interested in participating in a study or a trial, please reach out to me directly at jdryfhout@fellows.com. There are certain programs that we have there that certainly can we can get you started and make it worth your while. So with that, thanks for your time, and we'll open it up for some Q&A.
Thanks, Jeff. Thank you very much for the presentation. And thank you to all our attendees for listening in and for sharing some questions. Yes, we do have some time for Q&A, so I will pose the first to you, Jeff. You had mentioned toward the end of your presentation, you had a chart there with micron count and talking about the reduction in particles with a product such as yours. So I'm just wondering here, can you just talk a little bit more about how a facilities person might go through that process, if you are working with them, for instance, or if they're working on their own at a certain point, in terms of measuring, what is the before and after process to ensure that they are seeing improvement, I guess, is the question.
Yeah, absolutely. Very common question that we get, right back to how do we make that invisible visible and show that this is actually working. So what we would actually do is we've got, several people throughout the United States and actually other countries as well that can actually come to your organization, bring that particle counter, and measure the amount of particles, the amount of dirtiness of your air. And when we can also then turn an AirMax Pro unit on and show you and make one of those own charts of your own that you showed earlier, of showing the before and after with AirMax. What that does is it shows you the level of dirtiness of your existing air, and it also shows the benefit that AirMax can have in reducing the amount of dirt of viruses and contaminants in that air.
Thank you. And then there's a question about actually installing, or maybe the word is, the layout and how you would place some of these units. You had a slide up there with showing the 3 different models and the square footage coverage. Yep. And yeah, you had also talked about toward the end also some spaces, that shared spaces being obviously a big part of this. So for instance, for an open office area where it's not necessarily a conference room or a restroom, can you talk a little bit about how that approach might work in terms of layout?
Yeah, absolutely. I mean, it's all really based on the square footage, right, and really the cubic footage of an area. And so what we've done is we've got different sizes to kind of adapt to that. So kind of smaller areas such as, let's call single stall restrooms or examination rooms. The smaller unit is going to suffice there from 300 square foot up to larger spaces where it can go up to 1,400 square feet. And let's say you've got an open space that's larger than 1,400 square feet. Well, that's where multiple units then could work. So what we would do is we need to understand what the measurement of your square footage is, and then being able to let you know, and we've got a calculation there because I can show how many air turns you need in order to clean the air effectively. And that's what you're doing. You don't want to have a unit that is too small for a big area because you're not going to be able to clean it enough. And so we would be able to help you kind of dimensionalize how much air exchanges you're going to need to actually clean it effectively.
Great, thank you. And then talking about the cleaning process, how often do the filters need to be replaced? I saw you mentioned you had kind of a knockout of the unit itself, an example. So can you talk about filter replacement and any other maintenance issues?
Yeah, absolutely. One of the things we designed this with really the kind of that facility manager, building owner, operator, in mind, and so we did not want this to be a design that required a ton of maintenance. And so the filters, the HEPA filters that are in there are only need to be exchanged once a year. Some of the carbon is about every 6 months or so. So it's kind of the equivalent of changing the batteries in a smoke detector. It's really maintenance free. Really set it and forget it.
Great, thank you. And then I have a last question for you, honing right in on asking what are the costs for the units. Could you give us a ballpark on that?
Yeah, absolutely. The smaller unit, the AM3, is about $700, and then the largest unit, the AM4, which does up to 1,400 square feet, is about $2,000. And then in terms of just annual cost, then with the filters are about $150, but a 2-pack. So your annual cost is about $75.
Great. Great, thank you. So that's the end of our questions. Did you have any additional comments, or we can go ahead and conclude.
Yeah, no, thank you very much.
All right. Thank you, Jeff, and thank you to Aromax Professional also for sponsoring the webinar. I do want to thank our attendees for participating, of course. And to let you know, a recording of the webinar will be available online at our website, facilityexecutive.com, and also will be available at the Aromax Professional website, and that's aromaxpro.com. So thanks again, everyone, and have a wonderful afternoon.